Hey there! Today we are going to discuss the differential diagnosis and pertinent questions to ask the patient when he has constipation or diarrhea. Let's begin. Alright, so first of all, the differential diagnosis if it is constipation. For constipation, the first thing is low fiber diet. Low fiber diet. Second thing, substance abuse. Opioids, they cause constipation. Third one, more general, hypothyroid and depression. So we cover this in the mnemonic DEF. So diet. This one we cover in social history. Hypothyroid, the questions we are supposed to ask are cold intolerance, hair and skin changes. Cold intolerance, hair, skin changes. And depression, we ask side scabs, which was covered in the previous video. So these are the causes for constipation. You have 4 differential diagnoses here. And the next one is constipation plus diarrhea. Constipation and diarrhea both. We only have 2 differential diagnoses here. One is IBS and the second is colorectal cancer. So in IBS, this is the only symptom that the patient will be having, and the patient will be a young patient. And here the patient will be an elderly patient, and no pertinent positives, no other pertinent positives. The history will be negative for fever, the history will be negative for nausea and vomiting. The patient will be only having abdominal pain, which is relieved by which is relieved by bowel movement. That's the only pertinent positive, and there will be history of stress. The next one is watery diarrhea. Watery diarrhea. So in watery diarrhea, let's just go in infection and inflammatory. That's how we are going to go about. So the first one in infection is gastroenteritis. Now remember, this can be bacterial, it can be viral, or it can be parasitic. Next, it's food poisoning. Traveler's diarrhea. Next, these are the infectious causes. Then there is pseudo-infectious, so pseudomembranous colitis. Pseudomembranous colitis. Then you have inflammatory causes. So this is the first, second, third, and fourth one. And this is infection. And now we are going to talk about the inflammatory causes. So in inflammatory, the first thing you're going to think about is Crohn's. Okay? In Crohn's, what are the pertinent positives you'll ask? You'll ask if he has ulcers in mouth. Ulcers in mouth. And also, do you rush to defecate, incomplete evacuation, and abdominal pain? Incomplete evacuation and abdominal pain. These are the questions. This is travel history, and this is history of antibiotic use, or have you been diagnosed with any infection recently? Food poisoning, have you eaten outside? Or relationship with food. We are going to cover all this after we are done with differential diagnosis. Next, after Crohn's, we have, now let's think metabolic or genetic causes. So then we have two: lactose intolerance and celiac disease. So for these two, they are going to be covered in one question. SAWDEF. So under diet, do you have these symptoms when you drink milk or consume wheat products? That's the question we ask here. Now let's think general. 8 and 9, that can be pancreatitis and hyperthyroidism. In hyperthyroidism, we ask, do you have tremors, skin, hair changes, and if it's a girl, we ask about menstrual history also. Okay, next thing we are going to talk about is bloody diarrhea. Okay, so the causes of bloody diarrhea, first we are going to see colon, the causes in the colon, and they are going to be infectious first. Again, infectious. So under infectious, we have dysentery caused by entamoeba histolytica, and then we have inflammatory causes. Okay, in the inflammatory causes, the first thing we have is ulcerative colitis. Okay, then you take C, colorectal cancer, and after C comes D, so diverticulosis. All right, and now let's think about what we are going to ask. So this, any relation with type of food, have you eaten anything outside or have you traveled, is what we ask here. And here, do you have any joint pain or a rash, and do you have a sense of incomplete evacuation and abdominal pain. Next, colorectal cancer, we ask about weight loss. We ask if they can even present with constipation and diarrhea. We have family history is very important over here. So family history is very important. Next, diverticulosis. This occurs in elderly, and this is a painless and heavy bleeding. And they can even have obstructive symptoms, so they will definitely have abdominal pain. And remember, diverticulitis this presents similar to appendicitis, but it's on the left side, left lower quadrant, fever, pain, nausea, vomiting. Okay, but this is diverticulosis, which is the cause of bloody diarrhea. So these are the 4 causes when it comes to colon. Now let's see the causes when we come to the anal canal. So in anal canal, we have the causes. First thing, hemorrhoids. Second thing, anal fissures. Now this is going to be painless, and this is going to be painful, and there will also be a history of constipation. Now let's think systemic or general causes. sorry guys, systemic or general causes. Just like we remembered myocardial ischemia for upper abdominal pain, we have to remember mesenteric ischemia over here. So the first one is mesenteric ischemia. Here the pain will be out of proportion to the examination, and also the patient will have frank bloody stools. Alright, the next one is angiodysplasia, which is also going to present as painless, heavy bleeding. And the next one, and then you think about any bleeding disorders. Okay, it's unlikely that this can be the cause, because bleeding disorders can present as various other symptoms rather than bloody diarrhea. But think about the quadrants when you come to the next causes. Upper GI bleeding. This can present mostly as melena and not frank bloody diarrhea. And the next one is chronic liver disease. So chronic liver disease can cause hemorrhoids, and then hemorrhoids can cause bleeding, blood and stool. Okay, so this is it.